So thank you very much, Thomas, and we are very excited to partner up with the TechFestival this year. And to be honest, I'm super excited to showcase some of the work we are doing here and some of the research we have been doing within AI. And if I can have this. So I will tell you a little bit about what is LEO Innovation Lab really. LEO Innovation Lab was set up by LEO Pharma to build technologies that will help millions of people suffering from skin diseases. We are not working with any pharmaceuticals. We are not working with any products related to LEO. We are purely focusing on helping people to get a better life when they have a skin disease. So, in general, we are created here. We are working within AI. We have a lot of different products, but our focus is and will be in the future AI and imaging, AI-assisted diagnosis, progression tracking, and prediction. That is what we're here for, and that is what we will be focusing on in the future. So why have we taken the focus on skin? Skin is really it affects millions of people. 1/3 of all people globally are affected by skin disease sometime during their life. That's a lot of people. Linking on that is that on top of that, we don't have enough doctors. That means that we have an unmet needs also within treatments. Looking at that, this is in the Western world. Imagine how it is in the developing world. This is even worse. So, skin disease is something that is really misunderstood by people because it affects people psychologically and physically to an extent you would never believe. And if you talk to people, if you talk to your friends that have a skin disease, and you probably don't know who it is because people don't talk about it, you will experience that it is really impacting them to an extent that is quite impactful. So, when you're looking at what happens really with a person living with a skin disease, and it's quite interesting because this is a journey that every person living with a skin disease goes through. They start by looking and seeing something on their skin. They start to go to the internet, find out, talk to friends and family, get some different tips and tricks. It can be everything from peeing in a cup to pour over your psoriasis or eczema because somebody heard that helps. In the end, they find out that it doesn't help. They call the doctor. This is the next issue they have. Because when you call a doctor, and if you're one of these millennials that everybody talks about, you're told that you can come and see the doctor in 2 weeks on a Thursday at 1 o'clock. In 2 weeks on a Thursday at 1 o'clock, I have no clue what I'm doing in 2 weeks. So it's way out. It's way too much. Anyway, if you get to the doctor, you get there, the doctor will look at it. This is the GP, general practitioner. He will see, it might be psoriasis. Because what studies have shown is that there's up to a 50% misdiagnosis rate among GPs within skin diseases. 50%. It's like flipping a coin. So, you might get something that works. You might get something that doesn't work. You end up saying, okay, I need to have a second opinion, so you go to the dermatologist, you get a referral to the dermatologist, and here you experience the next issue, because here you figure out that you have to wait. Officially, you have to wait for 1 month. Unofficially, in the Western world, you're waiting between 1 to 6 months to see a dermatologist. And a lot of these chronic diseases is elapsing over time. That means when you enter the doctor, you might not have the eczema or acne or whatever you see, so you're trying to show him on pictures. Anyway, you get to the dermatologist. He will give you a treatment that most often works. It's only about 10% misdiagnosis rate, and this is the normal thing among specialties. Then you have to take the next issue, because then you get a receipt, you go down to the pharmacy to pick up the thing. Up to 50% in the Western world never picks up the medication. 50%. Either because it's too expensive, it's too cumbersome, you didn't have the disease when you went there, so you have something that in 2 months you will need it and you forgot where it is, so on. Anyway, you get it. Then you have an issue in some countries. How am I going to pay for this? Is it too expensive? Am I going to pay out of pocket? Can I afford it? But if you get the medication, then you have to treat yourself. And how many of you have tried to treat yourself with penicillin for 10 days, 3 tablets a day? How many tablets is left after 10 days? 7 or 8, because you forget. And on top of this, if you have a chronic disease that you have to treat yourself with every single day, you tend to forget, also on purpose, because every time you treat yourself, you remind yourself that you're sick. And a lot of people just want to have 1 or 2 days where you feel normal. So in the end, there's a lot of pain points along this journey where people disappears out of the system. You forget, you don't want. When you look at AI and thinking about AI, so how will this look in the future? Because there's no doubt that AI will help in a lot of these instances, or could help. Because when you look at the future, you will see something on your skin, you will go to the internet, you will search, you will download an app, you will take a photo, the app will tell you, this is eczema, the best treatment for you will be this, not according to clinical trials, but according to what thousands of other people have been through before you. The result of that, you will say you want it, you push yes, 2 hours later it lands at your doorstep, you start treating yourself, you can chat with people, you can online chat with a doctor, and then you kind of just circle in this loop. And we estimate that probably in the future, and when I say future, it's probably about 7 to 10 years, up to 70% with skin disease will never see a doctor face to face. Because you don't need to. But this doesn't mean that the doctors is not useful. This doesn't mean that we don't need the doctors, because we need the doctors. Because what this example shows is that the people who can treat themselves can use this one. The people who have to go to the doctor to get the specialist opinion have access to the doctor. They don't need to wait 1 month, 2 months, 3 months. Because suddenly you have a screening tool by the doctors that help them actually make sure that you're only referring the ones who needs the proper treatment. And that is what we are trying to do with AI. It's not about taking away the jobs for doctors. It's about making sure that the people seeing the doctor is who can benefit from seeing the doctor. Because a lot of people with these diseases don't need to see a doctor. Because it's not such a serious disease when you treat it optimally in the beginning. So what we are trying to do is really, we want to empower the people living with a skin condition to take control of their own life. That we are doing by instant access to ongoing help. It's about the most effective treatment recommendations at the first touch point, because a lot of these people have been going on for 10 years without having a proper diagnosis. And you don't hear about it, because of course you don't die from a skin disease, but you live a life where you constantly have it and have to worry about it. So you need to have the optimal treatment in the beginning. It's about taking control of your chronic disease, because remember, when you have a chronic disease, when you treat yourself with medication, you treat a symptom, but you don't treat the underlying disease. A chronic disease is, by definition, something that relapses and is there constantly. So it's a matter of changing your life. It's a matter of looking at all the aspects around you that impacts a person's life. That is what a chronic disease, and the medication is only helping you at the symptoms. You need to take control of your own life. Then you have access to clinical advice and touch points, and the most important thing, you have access to accurate, immediate diagnosis. That is what we want to do, and that is what we are set out to accomplish, and that is what we are working for 100%, and this is where we believe AI can be a support tool for the future. We are working on chronic skin diseases, but a lot of these things is something that really have an impact for all chronic disease, because it is the same. It is about how you live your life holistically, and not only about the medication. So, in order to do this, we need more brilliant people in order to solve these issues, because this is not an easy task, and you hear that later from some of the team members. It is a challenge, and it is something we are set out to solve. So if you want to be part of this in the future, send an email if you have the skills, and if you're one of these brilliant people. If you're mediocre, don't apply. But if you're brilliant, apply and be part of the team that really will make the change for the future healthcare system. Thank you very much.